Thanks, Terry. I'm Wendy Zachary. Thanks for letting me come today. I'm actually boarded and trained in both internal medicine and geriatrics. I practice currently as a hospitalist, or some people call them inpatient managers. I think you're familiar with the concept. I only do inpatient medicine. This is sort of a new frontier in geriatrics. Most geriatricians traditionally just work in skilled nursing facilities, acute rehabs, assisted living facilities, nursing homes. But now, as we'll talk about, the population's changing and we sort of need geriatricians elsewhere, and that's how I ended up in inpatient medicine. So remind me again, is everybody here works in psychiatry?
Yeah, Department of Education.
Okay, great. But everyone else is psychiatry.
Yeah.
Okay, and nursing staff, physicians?
We're all nurses.
Everybody nursing staff. Okay, great. So just wanted to kind of make that clear. Now, the way I kind of like to give talks, I'd rather not speak at you. It's actually kind of nice that we have a small group here. I want to make it interactive, more of a discussion than a lecture. So if you have any sort of anecdotal little stories or questions or comments that you want to make, or anything you disagree with, please feel free to speak up, because I prefer to learn something from you too while I'm here. So today, just a couple things that I wanted to make sure that we cover. First of all, we're going to talk a little bit about why your older patients are different than the younger patients. So changes that happen with aging and why that's important to you as nurses and healthcare providers in general. We're going to talk about why the hospital isn't always a safe place for your older patients. There's this misconception that you get into the hospital and you'll always be better when you come out, and that isn't always the case. And I thought that since you are in the psychiatry field, that we would talk a little bit about delirium. We're going to talk about what it is. So we're going to talk about how to identify patients who are at high risk for delirium. And I think by definition of being in the psychiatry unit that you probably already know your patients are at high risk for delirium. But we'll talk a little bit more about general hospital patients as well. So usually I like to dispel some myths about geriatrics, which we kind of already discussed. But most importantly, he's my husband. I know people always say, oh, you're Marcus's wife. And I say, no, he's my husband. So I think y'all, because Marcus says he comes up here and does, okay. And that's baby.
We got you.
This is baby Taylor. That's our little, I know. She just turned 1. She's great. Now, this is a little bit of a preaching to the choir slide, because I think everyone in healthcare understands that we are facing a crisis. And although I am a dramatic person, we are facing a crisis. Our population is getting older. This statistic is actually probably a couple years old, because the health census kind of falls behind by 2 years or so. They estimate that about 1 in 8 Americans is over the age of 65. That doesn't sound like a big number. It's a little over 10%. However, 1 in 3 of patients over the age of 65 are hospitalized every year. That's a big number. And of this, of the age, did I say that right? Yeah, 1 in 3 patients who are in the hospital are over the age of 65, and 1 of 3 people over the age of 65 are hospitalized every year. Now, if you think about how frightening those numbers are, pretty soon 1 in 3, or 33% of the population, is going to be over the age of 65. But the group that's growing the biggest is the age over 85. Again, just kind of anecdotally, I was doing a swing shift yesterday, and I admitted 2 people over the age of 97. 2. Admitted them to the hospital, which is disturbing on a number of levels, but you know, this is where we're headed. This is our population. I don't think this should be very surprising. I don't know, what is your population age for the most part? Do you have a lot of elderly patients in the psych unit here?
It seems to run kind of, sometimes we do, sometimes we don't.
Okay.
We'll have a whole lot, and then you know, we'll have 5 or 6 out of our maybe 22 patients, and then we won't have any for a while. But when we called you, we were having 7 or 8.
But think about it though, you're not even really a gero-psych unit.
No, we're not. There aren't any though anymore.
Right,
but
there aren't.
When CPMC closed their gero-psych, we did see an increase.
I can
The social workers were
imagine.
keeping kind of a tabs on the fact of how did it, because we have more walkers, more wheelchairs, more, just different things like that
Right.
going on.
More need for therapy. I'm sure your workload kind of goes like this when you have more patients there. I mean, it's...
She actually does the groups and things.
Oh, okay, okay. Well, you can see the difference, though. Hi. You can see the difference, even in a non-geropsych unit when you're having, if you have as many as 6 patients, I mean, that's, what, a fifth of your group. Okay, so again, this is my preaching to the choir slide. Everybody knows these things. But why do we care? Why don't we just treat these patients like we treat everybody else of all the other age groups? You can't do it. You can't do it. The elderly patient is a different scenario. When somebody who's younger comes in with pneumonia, you treat the pneumonia. When an elderly person comes in with pneumonia, they come in with all the medications they take, all their diagnoses, all their doctors, all their family. It's a whole other ballgame. So we have to be very aware of how our population is changing. This is a term that I preach to my colleagues all the time, and it's not a difficult concept. The concept of homeostenosis. People don't like to talk about this, especially in American culture, because people don't like to talk about aging, but everybody gets older, and everybody changes. And as you get older, your body makes changes that aren't always on an incline. So you do have your organ systems go through changes that eventually show a decline. However, if this process happens slow enough, if it happens gradual enough, if these changes happen in a more sort of timely fashion, then you can adjust for the changes. So I'll give you an example. Bone loss. If I were today to recognize, okay, I'm 35, my bone loss has started, I can take calcium supplements, I can change my diet, I can do weight-bearing exercises. The bone loss is still going to happen, but it'll happen sort of a little more gradually. However, if you don't give yourself the time to adjust for those changes, if I immediately lost bone today, I would break every bone in my body. Does that make sense? So in homeostenosis, we're talking about bone loss, we're talking about pulmonary reserve decreasing, we're talking about your liver function decreasing over time, we're talking about your kidney function decreasing over time. These, the lab tests that you see, your creatinine, for example, it's not adjusted for age. So you see a patient who has a normal creatinine and you think, oh, their kidney function's fine. But if you actually calculate their creatinine clearance adjusted for age, they're always going to have a decline. Because the older you are, the lower your creatinine clearance. Does that make sense?
I know. I was at my parents in March, and I noticed my dad seems so short of breath, and he's never been a smoker. He's a farmer. He's lived a very clean and healthy life, And it just amazed me that he was kind of...
And they're natural processes.
Right.
And I'm not suggesting that you should just poo-poo that and say, oh, he's short of breath, he's supposed to be that way. No. That's still something that would need attention to make him comfortable. But it's true. You do have decreased pulmonary reserves. There's some debate over whether or not cognitive impairment always happens with age, but that's a possibility and probably not all that surprising to you. So the way I've kind of defined this is I've put together a smattering of different definitions, and that's homeostenosis is a gradual but a progressive decline in your ability to maintain your reserves and an ability to function in your environment. So over time, this gradually happens. And if it happens slow enough, you can adjust for it.